Hello, I'm Dr. Steve Hotze, and I believe you need a coach to help you build a successful medical practice. I also believe that for you to have a successful medical practice, you need to know how to coach your patients onto a path of health and wellness naturally. Unfortunately, the modern medical paradigm in the United States that relies on pharmaceutical drugs and insurance as a means to provide patients with health care is broken. I believe you understand this, and that's why you're watching this session. I believe the medical pharmaceutical business establishment must be opposed and overturned. A wellness revolution has begun among enlightened people and thinking physicians like yourself that will transform the way that individuals and medical professionals will approach health. It is exciting, and it's a privilege for me to have the opportunity to provide leadership in this wellness revolution. More than 200 years ago, Dr. Benjamin Rush, a signer of the Declaration of Independence, warned about the loss of medical freedom. He wrote this: "Unless we put medical freedom in the Constitution, the time will come when medicine will organize into an undercover dictatorship to restrict the art of healing to one class of men and deny equal privileges to others. The Constitution of the Republic should make a special privilege for medical freedoms as well as for religious freedoms." My challenge to you is to join the wellness revolution and do a 180 in your medical practice. What does this mean for you? It means free enterprise medical care for your patients that is founded upon natural approaches to health. It means turning away from a reliance upon insurance companies for payment of your services and away from toxic pharmaceutical drugs, which often create devastating side effects for the people who take them. It shouldn't seem radical to recommend this to you, but I know it is completely counter to the current conventional medical orthodoxy. What you will learn in the medical modules that follow is 180 degrees in the opposite direction from what you and I learned in medical school and from what big pharma, the insurance industry, hospital corporations, the medical establishment, and the federal government want you to think. The implicit messages that we received during our medical education was that poor health was inevitable and that when it occurred, the solution was prescription drugs or surgery. I have completely rejected this paradigm, this belief system, and have done a 180 from what I was taught to believe in medical school about the way to evaluate and treat patients. Although I recognize that surgical intervention and pharmaceutical medications may be necessary in certain cases, I believe that conventional methods for treating the chronic problems that occur as we age are better served with a more natural approach. So buckle your seatbelts, because that is what I'm going to cover in the upcoming sessions. When you do a 180 and join the wellness revolution, your patients will enjoy a better quality of life. And you'll have more time, more money, and more freedom to enjoy your life.